the cheap drug that the cancer industry doesn't want you to know about. What if a drug that costs just a few dollars might have potential in cancer treatment? And what if the biggest barrier to studying it wasn't science, but economics? Hello, I am Dr. K. Paul Stoller, and I do have a webinar that addresses this subject at kennethstollermd.com. You see, for decades, doctors have used a class of medications called benzimidazole antiparasitic drugs to treat intestinal worms. Two of the most well-known are mebendazole and fenbendazole. These drugs work by disrupting microtubules, structures that cells use to divide. And that detail caught the attention of cancer researchers because cancer cells divide rapidly. In laboratory studies, some researchers noticed that drugs like mebendazole could interfere with the growth of certain cancer cells. In animal studies and cell cultures, these drugs appeared to disrupt tumor cell division, affect cancer metabolism, potentially slow tumor growth, keep sugar molecules from being absorbed by cancer cells. Because of these findings, some scientists began exploring whether existing antiparasitic drugs might be repurposed for oncology research. But here's where the story becomes complicated. Most antiparasitic drugs are very old medications. They are inexpensive and no longer protected by strong patents. That creates a strange problem in the pharmaceutical world. Large clinical trials cost hundreds of millions of dollars. If a drug cannot be patented, there is little financial incentive for companies to fund those trials. So even if a drug shows promise in early research, it may struggle to move forward. This challenge is part of a larger issue known as drug repurposing. Scientists frequently discover that medications developed for one disease might help treat another. For example, aspirin was originally a pain reliever, but it later showed cardiovascular benefits. Repurposing drugs can be extremely valuable, but without strong financial incentives, many promising ideas remain understudied. Some research groups have explored mebendazole in cancer trials, particularly for difficult cancers such as brain tumors. Early results have been intriguing, to say the least. The real question raised by this research isn't whether a single drug cures cancer. Cancer is a complex group of diseases with many different causes. The deeper question is this: are there inexpensive drugs already sitting on pharmacy shelves that deserve more investigation? And that is what my webinar is all about. But the public is never going to find out about them, as these drugs affect Big Pharma's bottom line if they were adopted for cancer treatment. Medical breakthroughs often come from unexpected places, sometimes from new technologies, sometimes from rediscovering old medicines in new ways. The challenge is making sure promising ideas are explored thoroughly, even when they aren't the most profitable. In my cancer webinar at kennethstollermd.com, I go over many of the alternative cancer treatments that are suppressed. The secrets to treating cancer appropriately are just a couple of clicks away. How much do you think economic incentives slows down important research? Let me know what you think in the comments.